In July 2017, Clontarf University Health Board were invited to join the National Patient Experience Collaborative, which is hosted by Northumbria NHS Trust. The PALS team, Cheryl and I, were asked to take the lead on this piece of work for Clontarf Health Board. The aim of the collaborative is to capture real-time feedback on the wards and feedback to the ward manager, any feedback that we've captured, and if there are any issues, these are raised before we leave the ward and dealt with at source. The surveys are going to be undertaken over a 12-month period, and in Clontarf we are capturing the surveys over 8 wards, 4 medical and 4 surgical in Prince Charles and in the Royal Glamorgan Hospital.
At first, when we provided the real-time survey to the ward managers, they could see the benefits of us feeding back from the pilot study on the same day. We were able to provide positive feedback from comments, and if any issues were raised at the time, these were dealt with at source on the ward.
Hello there.
Hello.
How are you today?
All right, thank you.
Oh, nice to meet you. My name is Catherine Davis.
And I'm Elizabeth, but Betty for short.
Right, okay. I'm part of the patient experience team, and we're undertaking a national pilot on the wards today. It's about patient experience. It's about 25 questions. It's completely anonymised and it takes about 5 minutes. Would you mind answering me some questions?
I don't mind at all.
As you can see, the feedback has been mostly very positive. We place all the feedback onto a "You Said We Did" poster, send it to the ward manager. The ward manager can then display it on the wards so the patients and staff can see that if there have been any issues raised, what we've done about it, and to capture all the positive feedback as well.
As we are the only health board in Wales involved in the collaborative, the learning events have given us the opportunity of networking with other colleagues across the border, which enables us to measure our performances across the collaborative and to share lessons learned. The collaborative has provided the PALS team with an opportunity to go out across the wards and spend time with patients, capturing feedback and meaningful conversations.
It's helped us, one from a time point of view, because we've collected patient data for a number of years now, and it's always been nursing staff who've collected that data, and obviously that takes time. But also I think as well from a patient's perspective is someone who's independent, so there's always been the feeling that they've been maybe a little bit reluctant to be completely honest with us about how they feel whilst they're still in hospital. I think the feedback has been really useful because it's in real time, so you can act on things that patients have concerns about. They're generally quite small things. Most of the feedback has been so positive, and that's really useful for staff as well. Staff morale is always much nicer, and they don't always get to hear those nice things.
How much information about your condition or treatment has been given to you? Do you think the right amount? A bit too much?
If you sort out the smaller things, what we tend to find is that it's an accumulation of the small things that makes the patient's experience not good, and that's when you get concerns raised. Since we've been collecting the data through PALS, we've not had any concerns raised through them at all, which is a big achievement then.